All right, today we're going to deconstruct a topic that, honestly, affects every single one of us, mental health. We're going to push past all the stigma and just get straight to the facts, the history, and most importantly, the tools we can all use to build strength.
I mean, who hasn't, right? If you've ever felt this way, you are absolutely not alone. These feelings aren't some kind of weakness. They're just, well, they're part of being human. And just acknowledging them, that's the real first step to understanding what's going on inside our own heads.
So when we use the term mental health, what are we even talking about? Well, the World Health Organization has this really powerful definition. And notice, it's not about the absence of something, like an illness. It's about the presence of things, like well-being, purpose, and the ability to bounce back. It's pretty much the foundation for how we think, feel, and connect with everyone around us.
Okay, let's dive right in. Here's our game plan. We're going to start with the sheer scale of the issue today, then jump back in time to see where all this stigma came from. After that, we'll get practical with a toolkit you can actually use and wrap it all up with the path forward.
First things first, let's get a real sense of just how widespread mental health challenges actually are. And I have a feeling these numbers might just shock you.
Just look at that number for a second. 970 million. Back in 2019, and this was before the pandemic, nearly 1 billion people around the world were living with a mental health condition. That's more than 1 out of every 8 people on the entire planet. It's just staggering.
And here's the crucial takeaway. When we talk about mental health, this isn't some fringe issue. We are talking about one of the most common health challenges of our time. It affects way more people than many of the physical diseases that we hear about every single day.
Now check this out, because the breakdown by age is pretty stark. Here in the US, 1/3 of young adults report having a mental illness. That is more than double the rate for people over 50. This really shines a light on the unique and intense pressures that younger generations are facing right now. And this points to some of those exact pressures. I mean, the digital world has completely changed our lives, but it definitely comes with a price tag. You've got tons of studies linking heavy social media use to huge spikes in anxiety. That feeling of being always on, the pressure to be perfect online, and, of course, cyberbullying. It's a whole new world of stress that previous generations just didn't have.
So to really get why it can still be so hard to talk about mental health, we have to understand where that silence and that stigma even came from. Let's take a quick look back through history.
You know, our whole approach has been this really slow, long evolution. It all started with this simple concept of mental hygiene way back in the 19th century. Then, pioneers like Dorothea Dix came along and fought for just basic human dignity. And in the 20th century, you finally see patient advocacy really take root, leading to this huge push to move care out of these massive institutions and back into our community.
This quote from Dorothea Dix is, well, it's chilling, but it's so important to hear. It just lays bare the brutal reality people faced. They weren't seen as patients who needed help. They were treated like outcasts to be locked away and controlled. This wasn't just neglect, it was frankly just inhumane.
And that history casts a really long shadow. The fear and the shame didn't just vanish when hospitals got better. It got baked into our culture. It created this stigma that quietly tells people that their struggles are something to be hidden, that it's a character flaw instead of what it really is, a health condition. Okay, so knowing the history and the scale of it all is one thing. But what can we actually do? Let's switch gears and talk about some practical, real-world tools for your mental health toolkit.
So here's a super simple, easy-to-remember framework, the 5 C's. It starts with care, as in actually taking time for yourself. Then there's connection with others, having the courage to say how you feel, showing compassion to yourself and others, and finally, consistency. It's really a whole-person approach to building up that resilience. And we can add even more to that kit with these daily habits. Now look, none of these are some kind of magic fix, right? But when you do them together, they create this incredible support system for your mind. Things like moving your body, getting enough sleep, even just setting limits on your screen time. These aren't little luxuries. They are essential maintenance for your mental health. So, after looking at the numbers, the history, and the tools, where does this all leave us? Well, it really all comes down to one core, game-changing idea. And it's this: mental health is health, full stop. We have to completely erase this imaginary line we've drawn between our minds and our bodies. Think about it. You would never tell someone with a broken leg to just walk it off, right? We have to bring that same level of understanding to our psychological well-being. They are totally, fundamentally connected. And the single most powerful tool we have to make this happen? It's conversation. That's it.
Every single time we talk openly about how we're feeling, we chip away at that old stigma. We let other people know they're not alone. And let's be clear, seeking help is not a sign of weakness. It's a profound act of strength, and it builds up not just you, but your entire community.
And that really leaves us all with a final question to think about. Because this isn't just about taking care of ourselves, it's about taking care of each other. A healthier world really does start with small things, like listening without judging and creating spaces where it's okay to not be okay. So what's one step you can take, starting today?